All right, friends, Dr. Nixon here, functional medicine doctor, founder of twincityhealth.com, holistic chiropractor. Today, I'm gonna walk you through a very important video of what I think you should ask your doctor to run for you. I wanna start off by saying, I don't run labs, blood draws out of my office day in and day out. That's not my practice. It's not what I do, nor do I want to do. But there are a lot of good doctors out there who will. Oftentimes you have to advocate for yourself. So my job right now is to try to educate you and empower you to be equipped to walk into your doctor's office and say, hey doc, here's what I would like you to run for me. And if they say no, you can fire them because you hired them. And if they don't do their job, you might want to get rid of them and find someone that will. Thankfully, here in town, I have a list of practitioners, doctors, medical practitioners, integrative doctors whom I have vetted out, I really like, who will work with you. They may not be 100% on board with everything that I might say, and that's okay, but they're willing to run labs for you. One of them that I think of all the time and send a lot of patients to in Winston-Salem, North Carolina is Robin Hood Integrative Health. They were upstairs above my first office, phenomenal human beings. The owners are top-notch, amazing practitioners, but amazing doctors who will help you, who will fight for you, pray for you, and equip you with how to take care of your health. So you have like a primary doctor, then you go integrative doctor, and then if you need me, and only then if you need me and hit plateaus, then you can find a functional medicine doctor. In functional medicine, I only do gut health, hormones, men and women hormones, mycotoxins, which is mold, and methylation pathways, which is mthfr. If you need help with those four things and you've done integrative already and you need more help, I'm here to help you. Otherwise, find yourself an integrative doctor who will run these tests or a good primary doctor who will run these tests on you. Most doctors will start right here, CBC, CMP. You're gonna get a lot of data. Hey, you're gonna spit out 30-something numbers, but at the end of the day, it's the tip of the iceberg of what you're actually looking for. But you get your red blood cells, your white blood cells, differentials. You get your blood glucose and your carbon dioxide and your kidney numbers and your liver enzymes and all that's wonderful, good stuff. What you're going to ask for, and oftentimes a lot of doctors will say yes. I'm gonna tell you why. You're gonna help them say yes. Hey doc, will you run my vitamin D3? Vitamin D3 is part of your immune system. Over 200 of your genetics, most of those are in your white blood cells, uses vitamin D3 to activate that genetic process. So you want to know where your number is. The scale for vitamin D is very big. 30 to right around 100 is what we call normal. In my opinion, what I've seen in the research and where I keep my number, I'm shooting for my number to be somewhere in the 60 to 80 range. I run these numbers on myself. 60 to 80 range is where I want to be. Why? Because that's where the research is done on cancer. That's where the research is done on type 2 diabetes and preventing it. That's where the research is done on metabolic syndrome and weight loss and how to help it. Vitamin D3. The next one here you want to run vitamin B12. B as in boy is good for your brain. Optimally, this number is going to be under 1,000. I like to keep mine somewhere in the 700-ish range, 700 to 800. It is water soluble. So if you take too much or too little, but if you take too much, it will wash out through your urine, but 700-ish is where I want my B12. Why do we want to test this number? If this number is through the roof, and you're not taking B vitamins, that tells us something that you might have a genetic mutation. If your number is down in the dumps and you've been taking it, that tells us something. You most likely have a genetic mutation that's causing this. That mutation is called mthfr, methylene tetrahydrofolic acid reductase, and that answer, knowing that, can literally change your health, especially if you have autoimmune diseases, things like fibromyalgia, chronic fatigue syndrome, any type of inflammatory response in your body. Figuring that out can literally change your health. The next one you're going to ask for is called CRP. In fact, you're going to ask for HS. That's the newest one on the market. It's called high sensitivity C-reactive protein. traditionally used as a cardiovascular marker. Oftentimes, they'll run this on a patient after they have a heart attack. What if you ran it on them beforehand? You could have seen all the inflammation that was in that person's cardiovascular system. So that's why you want to run that number, and you want this number as close as possible to 0. Mine sits at a 0.4. I've seen one person in the last 13 years with a lower number, but mine just consistently comes up at a 0.4. This number is important to me. My dad had heart attacks, back-to-back heart attacks in his mid-40s. They did quadruple heart bypass on him. They saved my dad's life. I'm grateful for our emergency medical system. They saved my dad's life. After my dad's second heart attack, he woke up. He said, I've got to change some stuff, and so he did. I'll tell you the story. He lost the weight, lost over 100 pounds, changed the way he ate, changed the way he moved, was taking care of his body, taking care of his nervous system. His best friend was a chiropractor and said, hey, bud, if you make these changes, you can be around for your family. And my dad is in his 70s now, on 0 medications, hanging out with his family and his grandkids. Get that number ran, HS, CRP. The next thing you're gonna ask for is another inflammation marker. Inflammation is at the root cause of a lot of diseases. Anything that ends in those letters itis, I-T-I-S, that's inflammation. So arthritis, gastritis, etc. You would like this number to be low. Ideally, this number would sit at a 7. 7 is the sweet spot in functional medicine to optimize homocysteine levels. Homocysteine levels rise in response to a lot of different things, but if that number is high, it increases your risk for all of the bad diseases, cancers, heart disease, type 2 diabetes, metabolic syndrome, etc. And it's a number that you can change because you can take action steps. The next thing you're going to do is you're going to ask for a full, use that word, full. Hey doc, can I have a full thyroid panel? And a full thyroid panel consists of TSH, T4, T3, reverse T3, TPO, which is an antibody number, is a full thyroid panel. And if your doctor says why, this is important, don't lie to them, but your thyroid regulates energy hormones and weight loss hormones. So if you've thought to yourself, man, my energy is not what it could be or should be or was, it's harder to lose weight than it used to be. Like those would be reasons that anyone would want to look at their thyroid. If he says, why do you want a full thyroid panel? And you say, because Dr. Nixon told me so, he's going to say, well, tell Dr. Nixon to run it. And I'm going to tell you no. So ask your doctor for a full thyroid panel and tell them why. I'm empowering you guys. The next one you're going to ask for is a lipid panel. A full lipid panel. This one's really simple. Every doctor will most likely say yes to this. This is your good cholesterol, your bad cholesterol, your HDLs, your LDLs, etc. Okay, really, really simple. As you guys get these, if you're patients of mine and you want to bring these in, I'd love to help coach you through them, look at them with you. And the next one you're going to ask for, again, every doctor is most likely going to say yes to this one, is A1C. A1C is a 3-month mathematical equation of what your average glucose blood sugar is. You want to see that number nice and low. They will qualify people as pre-diabetes. Pre-diabetes is oftentimes the little like, hey, looks like you're eating too much sugar. Buddy, you might want to eat less, which is good. And sometimes we need that wake-up call. And it's a number that you can change, and you're going to want to rerun it if it's high in 3 months so you can see the difference in what you're doing. And here's the bonus one for men out there. Please, anyone past the age of 35, I would recommend you get your free and your total testosterone ran. Testosterone is more than just a sex hormone in your body. It is cardioprotective. It is brain protective. And after the age of our late 30s, it's harder to make it. So if you want to live into your 60s, 70s, and beyond with cardio protection, brain protection, and a sex hormone that works, get your number ran early and optimize it. If you're in your 30s and 40s, that number really needs to be above 800, in my opinion, even higher if you can get it there. As you get into your 50s and 60s, if your number is at 200 and you never tested it before or knew about it or knew what to do to fix it, it's gonna be really hard to do that and things won't work properly. So get your numbers ran in your 30s, your 40s, your 50s, please. Please, please, please. So total and free testosterone. If you need any more help with understanding what to do or what to ask your doctor for, please let me or my team know. I love you guys. I hope this was helpful. This was Dr. Nixon with Twin City Health.